Senator Hendren, are you there?
I am here.
There he is.
Very good. Good morning.
Good morning.
All right, so we were just kind of giving a little preview. I didn't want to step in and talk to your bill. I wanted to let you do that openly. We've got a lot of folks who are really interested in hearing about it. You filed Senate Bill 96 last week, which is part of the Health Reform Task Force, sets up sort of stage 2 for the private option past 2016. I'm just going to kind of open it up to you. Tell us what it does, and then we can do a little back and forth with it.
Well, absolutely. I think what it does is it tries to chart a responsible path forward. I mean, the main thing that it does that I know a lot of your listeners are concerned about is it does not reauthorize the private option, nor, in fact, it directs DHS to submit the necessary plan amendments to end Medicaid expansion at the end of December 31, 2016. So it basically puts in place a scenario where if there is no further action by the legislature, the plan is Medicaid expansion is gone by the end of 2016. I found that task forces that we have created in the legislature only seem to produce fruit if they have a deadline, so it sets a hard deadline. And speaking of the task force, I mean, the legislation specifies who's going to be on it, and I have gotten assurances, and I am certain that there will be fair representation for people with opposing points of view. And then the task force has a role to play with regard to coming up with a path forward in 2 areas. One is the traditional Medicaid program, which people don't seem to be talking much about, but don't seem to realize that that's 5 times the size of the Medicaid expansion population and is more expensive than the national average. So you're talking about $1 billion of state money versus even at the end, if the private option went on for 5 more years, you're talking about $200 million. So it's a tremendous strain on the budget, and it needs to be reformed. So the Medicaid Task Force will have a deadline of 2016 to prepare a set of block grant and regulation exemptions for the federal government. And the purpose of our visit to D.C. was to see whether they would entertain those type of changes to the current Medicaid program. Now, it will also look at what might happen beyond the private option. And I think one of the things people need to understand is, as the chairman of the task force has been working 1.5 years on teachers' insurance, the task force can recommend, can study, and can do whatever we want, but we can't change the law and we can't do anything. The only part of this bill that really does anything is Section 5, which is very clear that it directs DHS to prepare the necessary plan amendments that when the private option waiver period expires, there is no Medicaid expansion. So that's what the bill does. I'm used to people saying legislation doesn't do what I say it does, but at the end of the day, I think I've been doing it a while, and the legislation will do that, or I won't file it.
Right. Okay. So one of the big things that I've gathered is based on Governor Hutchinson's public speeches is that he does want the task force to figure out some sort of coverage option for the expansion population past 2016, but I want people to be clear, your bill does not say at the end of 2016 they will just revert to traditional Medicaid, because that's what I've heard the criticism is that your bill basically would take away our state plan amendments in the sectional M15 waiver, which allows the delivery option of private option, but it doesn't actually end the population of expansion. As of right now, until new action is done by the legislature, your bill would actually end the expansion population of that new 225 without further legislative action.
Well, that's right, Jason. We've got a lot of folks who've never written bills but stayed at the Holiday Inn Express or got a law license who are trying to tell me that the bill doesn't do that. And again, as I said, this isn't my first time down here. And what I'm telling folks is go back and look at my legislation and see if it doesn't do what I say it's going to do. But there's 2 things that have to happen for Medicaid expansion to go away. One is, obviously, a lot of people say, well, it's going to go away anyway at the end of 2016. Well, the private option will. But if we do not change our state plan, Medicaid plan, we would go right to Medicaid expansion.
Yeah. And
this bill directs that DHS do that. And not only that they do it, but they begin the process early enough so that the plan can be amended in time for a December shutdown of the Medicaid expansion in 2016. So you're right. There's a lot of confusion. I'm going to consider adding some clarifying language to try to make people feel better that this bill actually does what I say it does. But again, because I understand the confusion, it is hard to understand when you remove an eligibility criteria why that actually reduces the population. And again, it's something I spent a lot of hours trying to ensure that there was no mistakes on, because it is a big program and it needs to be correct.
And if I'm correct, you filed this bill, I think, Friday. You haven't even had a hearing. Wednesday will be the first hearing, and so this is a very early draft of the bill. I mean, this is a starting point, right? I mean,
well, you're right. I mean, I filed it late Thursday afternoon, and I've told many people, I've said, look, do not, in fact, I've prepared some groups, when you see a bill, don't freak out. It's pretty normal. If there's things in there you don't like, it's pretty normal for a bill to sit there and after it gets exposed to the public, for a process to go through to make sure that it addresses everything that we intended for it to address. So, again, I understand people's concern, but, there's also folks who make a living out of finding issues to be upset about. But,
yeah. So here's a good question. We've had a number of folks talk about this. If I read correctly, one of the visions of the original private option was that it would start moving existing Medicaid populations over to the private option. I think our kids B's on the list. Does your bill, if I'm correct, it would stop migration to the private option, correct?
It does. It stops migration to the private option. It also terminates some programs that are completely have not proven to be effective, and will save $3 million over the next 2 years. They'll save $6 million, so $3 million per year. So, I mean, again, it's not something that we just do together. It's something that we've tried to develop. It says, look, we're going to stop this thing in its tracks. We're not going to reauthorize it, and we're going to put together a task force. Now, the task force is going to look at, if anything, what we do for the population beyond that. Now, many of us will not support Medicaid expansion, but to say that it's not fair to at least look at it is unreasonable. But again, the task force can't change anything. So, as I said, I think what the governor has laid out is a very responsible, unwind, pause on this plan, and give us an opportunity to determine how are we going to get this spiraling health care cost, not just for the expanded population, but for the other $5 billion that we spend on the current Medicaid population.
Yeah, because you and I remember, I mean, in 2012, the Medicaid trust fund was broke. I mean, there was $0 in that Medicaid trust fund, and so we've gotten a broken and costly system, and we've seen some reforms in existing Medicaid, Office of Inspector General, et cetera, but more must be done to tackle that. Most people don't realize the expansion population is about 225,000. Traditional Medicaid is probably around 750,000. Isn't that right?
It is right, and it's much, much more expensive because, again, in the traditional Medicaid population, you're dealing with severely challenged health situations and elderly and disabled. So it is tremendously expensive, and that's where the savings is going to be. So my hope is we have the opportunity here to do, because we will have some leverage moving through 2016 as this really does come upon the end date of this thing to force the federal government to give us some aggressive reforms on the current Medicaid program, which could, instead of saving $10 or $20 million, it can save hundreds of millions of dollars for the taxpayers and institute some things we all support. So individual responsibility, work requirements, and some of those things that we've always talked about, we have the opportunity to do those things. So, again, it's something that I think when conservatives fully appreciate what we're doing here, should support.
So my one question, and we got it in from a listener, and this is something I think is a legitimate question. I mean, we talked about how we're stopping certain migrations. Is there any plan or any idea or any legal footing or any thoughts that you have about putting a hard cap on enrollment? Is that something that you've talked about, and is that something that you're trying to do?
It is something I would love to put a hard cap on enrollment, and that's one of the reasons that I went to the meeting in D.C. and sat across from the Secretary of HHS and said, listen, we've been told that you all want to approve this and that you have not approved this in other states. And I said, I just need to hear from you directly. I said, obviously, you're going to tell me what you want me to hear, but have you done this in any other states, and is that something that is even possible in the next 22 months of our waiver? And she could not have been more clear. And I know there's a lot of distrust and mistrust in Washington, but the way they interpret the federal law is you either have expanded Medicaid population or you don't. And if you do have expanded Medicaid population, and in fact the part that we're repealing in this bill says you cannot eliminate anybody based solely on income. So in other words, when we expand it, you cannot set another criteria. If somebody is at 75% of the federal poverty line, they will be covered. So you can't. That's the law. It's not a policy or a regulation.
Sort of probably like an anti-discrimination policy, in that some people got it and some people wouldn't, even though they're equally eligible.
As much as we would all like to cap it, and there's talks about caps in other states, and again, I found out, like a lot of stuff, it's just not factual. There's caps that have been done on the traditional Medicaid expansion, or on the traditional Medicaid population, but subsequent to the Affordable Care Act and the expansion under the terms that the law stipulates there, which again, part of my frustration was, sometimes the Obama administration picks and chooses which laws they want to enforce. But this is one they're going to enforce, certainly is, whether we like it or not, there is no option. And that's, to me, the cap comes at the end of 2016 when the program is terminated.
Yeah.
The other reason, again, that I think getting so hung up on a cap, there's a lot of people who say this thing's going to go to 300,000 or 400,000, and those folks just haven't read the actuarials and the studies. And I'm having spent a year and a half studying teachers' insurance. Mathematically, they can get pretty close to this, and all of those have said it's going to be between 220 to 250. We may be surprised, but I don't think getting hung up over a cap on a 12-month difference in time period is worth defeating an effort to end this program, which is what we're trying to do.
I think that's a good point. Senator Hendren, thank you so much for answering our questions today. We look forward to following SB96. And, of course, we'll have the other side of the argument on the air tomorrow, so be sure to listen in. And we can go back and forth and get our listeners involved in their local government. Thank you so much. We know you've got a 7 o'clock meeting, so we're going to let you head out. We appreciate your time, Senator.
Thank you all for having me.